This second video is about another aspect of what it's like to be a parent when you're a trauma survivor. The fact is that what it takes to be a good parent varies as the child grows up. So what's expected of a parent of a baby is very different from what's expected of a parent of a teenager. And there can be challenges in each stage for a trauma survivor parent. That's what we're going to talk about now. Again, the information is adopted from Kay's workbook and from Risking Connection curriculum. Again, we're looking at what makes parenting especially hard for survivors. We're going to look at 6 stages of parenting: pregnancy or adoption planning, mostly pregnancy, infancy, toddler, preschool, school age, and adolescent teenage. When someone is pregnant, the baby is growing using the nourishment of the mother's body. The role of the mother is to provide the best possible environment for the baby to grow. And she does that through nourishment and also through emotional stability. We know now that the mother's stress, fear, anxiety, distress all gets transmitted to the fetus through the chemicals of the body. Plus, we know more about what is positive nutrition for a baby and what things might harm the baby. Furthermore, there's been a lot of research on the effect of drugs and alcohol on the baby. So all these things the mother takes into account as she's pregnant. Now, we have to remember that people who have experienced early childhood sexual or physical abuse have a conflicted relationship with their own bodies. They may not be tuned into their body, they may not feel connected to it, they may not be able to read the signals of their body, and all the huge changes that happen in pregnancy could be extremely disconcerting for any mother and are especially disconcerting for a trauma survivor. Then again, there's also all the appointments, the internal exams, etc., which can be triggering for a trauma survivor, especially if the physician is not compassionate and tuned into these issues. Another challenge is that a mother who's been through trauma may have psychiatric symptoms and may be on psychotropic meds. She may have to stop those meds when she's pregnant in order to avoid harming the baby. So therefore, something that has helped her maintain emotional stability is taken away. Or she may be doing her own self-medication with drugs and alcohol. Again, she may stop those to try to avoid harming the baby, but what does she do instead to calm herself down, to help herself through all the tumultuous emotions of pregnancy? The mother may be afraid. How is she feeling about this pregnancy? What support does she have? What support is she getting from the father, from her family? All these things weigh into what the pregnancy is like for her. And then there's the father. What is he feeling in this experience? If the father himself is a trauma survivor, he may feel useless. He may feel like he has nothing to offer this baby and have trouble picturing himself in the role of a father. It's very important, as you'll see in every stage of parenting, that the parent has other parents to talk to. A lot of the things that the mother may feel are unique to her might be in fact common stages of pregnancy. There's lots of information that can help her understand what's happening in her body and what she and the baby needs. She needs to be cared for and nurtured in order for her to care for and nurture her baby. She needs to connect with other women. Throughout time, women have supported each other through this pregnancy period. And she needs resources and help so the mother may need help with some actual practical help to get ready for the baby. Then the baby's born. An infant. For a mother who herself feels inadequate, unworthy, shameful, It may be very terrifying to have this small creature completely dependent on her. She may have thought she'd have a baby so someone would love her, but instead this baby is needy, always wants something, and is sometimes hard to understand what's going on with them. It may be the baby at times can't be soothed or is crying, or she doesn't know what the baby needs. The mother may feel overwhelmed by the constancy of the baby's needs. She may look at this small creature and feel like, I'm responsible for this person. Another very important task of parenthood at this time is to help start building the baby's brain. And through this, the way that we do this is through attuned interactions, through cooing and playing and being delighted with the baby and having time where we're cooing back and forth with the baby, and each of the parent and the baby are influencing each other. Is the mother able to relax enough to do this? Is she calm enough in her own life, happy enough, taken care of enough that she can relax and connect with her baby? The mother, of course, and both parents have to keep the baby safe. They have to get the equipment and supplies needed to meet the baby's needs. They may have unrealistic expectations of how well they should be able to understand everything the baby does, how they should always know what to do, and judge themselves by these expectations. Another factor that comes into play with a baby is this. If a person is hurt when they were small and vulnerable, when they were too small to take care of themselves, people took advantage of that and hurt them. They often end up with a feeling of fear of vulnerability, not only of their own vulnerability, but of whenever they see someone else who's small, unprotected, it can arise all sorts of horrible feelings within them. They may have that reaction to their own baby, like seeing something so small and so vulnerable makes them cringe, and they almost want to say to the baby, toughen up, it's a tough world out there, you've got to grow up quickly, because their neediness is so scary to mom. It's so helpful to be able to talk to other mothers and thus understand that nobody always knows what their baby wants. Nobody can always soothe their baby. Plus, other mothers can help each other with all sorts of practical questions. When do you call the doctor? What does this rash mean? When do you start solid foods? There's lots of information that can be shared with the mother to help her with understanding what to do and feeling more confident in herself. And then the mother needs coddling herself, time to meet her own needs, somebody to take care of her and to make her feel like she's not just giving all the time. She also may need some practical resources, diapers, food, equipment. Those kinds of things can also help. Then the child becomes a toddler. At this time, the child starts exploring the world more and developing into a person with their own opinions. And often that opinion is expressed in the simple word, no. The child can become defiant or less cooperative. The child also becomes much more mobile, moving around a lot, and thus can get into more danger and more harm. And the mother has to make a safe environment and protect the child from bashing his head on a table. Then this is the beginning of a lifelong task where the child needs both the freedom to explore the world and a safe base to return to. The mother could possibly err on either side, that she could be like, you're never leaving my sight because the world out there is so dangerous. Or she could be so overwhelmed her own life that she could say, oh, go away and play, don't bother me. Instead, she has to find that balance of both autonomy and safety, which can seem very tricky. As the child starts to go out in the world a little bit, all the mother's opinions and fears about the world are brought to the forefront. The world is a dangerous place. Is my baby going to get hurt out there? How does she encourage his growth and learning and connection to other children and so forth when she feels like the world is such a dangerous place? And then there's the dad trying to find his role at this age and what is his part in all this. Again, it will really help if the parent can talk to other parents, find out that these stages and this saying no and developing more autonomy, that it's very normal for this age. The parent can be provided with information about the developmental stages and what's appropriate for this time. Again, the parent could really use a break every now and then, whether it be through daycare or preschool or anything like that, or a babysitter or a relative. So as the child goes into preschool, this same process accelerates. The child starts to connect with many more children, starts learning more complex language, and begins to learn about taking care of themselves, getting dressed, feeding themselves, and also to learn about feelings. What are they? What do we make of them? How do we handle them? And what do they mean? So the parent is there to support all this learning and to help the child expand their world, while at the same time teaching them social skills, manners, and teaching them about feelings. The parent teaches the child about feelings by every time that they say, oh, you seem sad, or you're upset, let's go for a walk, or here, let me kiss it and make it better, or stop crying, you're a boy, boys don't cry. All those messages are messages about what are feelings, what are the words for them, and what do we do about them. The parent is also teaching the child about feelings by what he and she do, how they handle their own feelings every time they're upset, and what do they do about it. So that's a major part of the parent's task. So the child begins to have more exposure to this dangerous world. Also, at this age, the child begins to be aware of racial differences, and they begin to be aware of whether they're being treated differently because of race. The beginning of a long and complicated discussion and modeling that the parent is going to have to do for the child. Understanding the developmental stages and talking to other parents will help the parent to be more realistic, to have expectations, and also to look at what connections do they have themselves, what support do they themselves as parents have. So then the child goes to school. And now there's all sorts of other demands. The child becomes very involved in a social world outside of his family, making friends, having conflicts, being left out, being included, finding his own skills and finding areas where he doesn't do as well. All of this involves a lot of work on the parent's part. For the one thing, the parent has to manage all the details. If the child is in a sport, the parent has to get them to the sport and take them home and get them the equipment, and the parent has to monitor their homework and maybe help them with the homework. They have to respond to issues in their social world. They have to set limits and offer judgment and guidance for them. But the parent may not have the skills themselves to do all these things, or they may be overwhelmed by their own struggles to do all these things, and then feel bad because they say their child missed a practice because they overslept. Also, the parent is brought into interaction with more people as the child's universe expands. The parent now has a lot more interaction with the school, which of course brings up their own experience with school and with authority figures. The parent may encounter people who are blaming of them and who, for example, blame them because their child didn't do his homework. And if the parent tends to feel self-doubt, they may think, oh my God, he's right, I'm a bad parent. And then there's the issue of racism at this age. What sort of world is the family living in? Is it a safe world? Is there a lot of danger? What sort of school is it? Is it a school where the child can get individual attention and support? What are the personnel like towards the parents? Do they reach out and include the parents and welcome them? So the parent continues to need connection with others and a lot of information, and they also need physical help like carpooling or activities, for instance, after school activities, if the parent has to work, that they can trust, and they continue to need respect and compassion. It's a big jump from school age to teenage years, but the teenage years bring a lot of complicated issues to every parent. One thing about being a trauma survivor that I mentioned is the issue of the body, but to be more specific in this section about sexuality, what kind of ideas does the parent have about sexuality? What has been their experience? Has sex been an area of pain and hurt for them? If so, how are they going to present sexuality to their child, both in formal discussions, but also in the everyday interactions? The child, as an adolescent, is really trying to find out who they are. What is their identity? What things are they interested in? What skills do they have? What part of the world might they be interested in working in? They're looking at their own sexuality, their sexual orientation, their gender roles. They're experimenting with friends, with dating, with they have a lot of peer pressure and pressure to belong and so forth. And then there's the area of electronics, where there's all sorts of possible bullying, lots of connection and lots of distress. And then there's video games. So the parent's left with lots of impossible tasks, like how to manage all this, and especially what to let the kid do and what not to let them do in an ever-changing, evolving world. What's dangerous and what isn't dangerous. The parents trying to teach their kid, not just make rules for them, but teach them how to judge what's safe. And they're also trying to teach them about healthy sexuality. Hard to do if your own sexuality has been abusive. And oftentimes parents who have been trauma survivors have not had examples of positive discipline and of cooperatively set limits. So another area of struggle. This is where parents really have to gang up together because their kids are ganging up together and try to get some ideas about what other parents are doing about these complicated questions, and to see what the social norm is. Not that you have to go by the social norm, but at least it's nice to know what other people are thinking and doing about areas like electronics. And there's the racial issues at this stage too, because this can be the time when parents of color start to feel especially frightened for their children, especially boys, but both, that if the children don't behave in a certain way, they could actually get shot. And they have the talk to teach them about how to behave if the police were to pull them over, all these incredibly painful things. Parents of color are trying to give their child hints about how to operate in a racist world, which the child may accept, may reject. It's a very painful issue. White parents are trying to teach their children whatever they believe about racial justice. So the more we can work towards a racially just world, the less these horrible stressors will add to the other many stressors that parents face at this stage. I mentioned that there's that trauma survivor parents may not have had good models of discipline. Discipline meaning learning. It comes from the word disciple, and discipline is to try to teach. So we can be helpful by teaching parents how to discipline collaboratively and how to think about what you're trying to teach your child. Another problem that comes up is that sometimes parents feel guilty about past mistakes that they've made. For instance, someone who's had their children taken away, but now they're returned to them. And that guilt they feel about the past can paralyze them in the present. So like, how can I say she can't go to that party when look what all she's been through, when in fact that party is a dangerous one to go to. So we want to help people talk that through, and maybe even talk it through between the parent and child. We want to teach people that Children don't, in fact, do their best because of fear. They do their best because of love. The more they're connected to their parents, that's what'll help them make good decisions. Many of our survivor parents are parenting very difficult children, especially if the family's been through a lot of hard times. They may be parenting a child with severe behavioral problems, and we have to help them find the resources to get help for their child. I mentioned about guilt and shame being paralyzing for a parent. One of the things that we all have to figure out as parents is what to do when we make mistakes, because all of us make mistakes. Everybody's had the experience of yelling at a child or making an immediate decision that they later regretted, or just losing their cool at some point. It's not that anybody's not going to make mistakes. Sometimes parents have made big mistakes. Children have an amazing ability to forgive and reconnect. That's what we have to reach for. Children learn from mistakes that are repaired, from ruptures that are reconnected. That's what will help build good brains and good, loving children. So when we make mistakes, it's what do we do afterwards? How do we apologize, acknowledge it, and reconnect? And then we want to think about, for ourselves, about what led up to that mistake, and maybe we need to add some self-care, some breaks for ourselves, some things that we find restorative to help us not need to make those many mistakes. Any cycle can be broken at any point. Parents are always teaching kids about touch, sexual touch, non-sexual touch, boundaries, personal space, what is appropriate, what with whom. It's harder to teach that if your own experience with it has been problematic and painful. What makes parenting possible is the joy, is the love, is the moments of connection with the child, the moments of seeing the child do something new or cute or something that you're proud of, is seeing the world through the child's eyes in a new way, watching the child take delight in blowing bubbles, having fun together, laughing. These are the joys that are the fuel for the difficult time. Finding hope that who your child can become. But can a parent do this if they themselves are feeling stressed out, overwhelmed, unable to manage life? Can they appreciate their child? Can they play with them? How can we support that? We want to give parents the message that playing with your child is the most important thing you can do, much more important than discipline. We can't actually just say to parents, go home and play with your child more. We have to actually teach some parents how to do that because they were never played with themselves. And we may make time for play within our sessions, or we may want to have events in our programs that bring the parents and children together in joy, such as picnics or game days or things like that. We want to promote play and joy between parents and children. It's hard for survivor parents to ask for help. They blame themselves and assume that others will blame them. They feel so lousy about not doing what they think is a good job that they hate to reach out and show anyone what they see as their failure. So let's talk about that. Let's bring that out in the open. And then let's talk about where do you find help and where do you find the right help and have resources to give to our parents. In our next segment, we're going to be talking about what makes the right help, what kind of help is help for survivor parents. Be sure and watch the video on weathering that is part of our Blackboard.